Your liver is the largest organ inside the body. It helps your body digest food, store energy, and remove poisons. Coming up on Polk Place, we will talk with the Florida Department of Health in Polk County about a disease affecting the liver that's spreading across the state at an alarming rate. Make sure you stick around. Welcome to Polk Place. I'm your host, Lauren Lingell. Joining me in studio today, we have Kayla Lewis, who is the manager of the hepatitis program, and we have Dr. Joy Jackson, the director of the Florida Department of Health in Polk County. Ladies, welcome. It's so good to see you back again, and it's so nice to have you. Hep A, I admit I don't know a lot about it, but I think that's probably along the lines of how some of our viewers feel. So, what is it?
Okay, hepatitis A is a viral infection of the liver. And this hepatitis A is a fairly contagious virus, and it's spread from person to person. It's a fecal-oral route, which means it's somebody that has hepatitis A who perhaps didn't wash their hands thoroughly or touched items that another person unawareingly ingests can contract hepatitis A. And if they're going to develop symptoms, it may take 2 to 7 weeks, generally an average of about 4 weeks before they develop symptoms if they're going to contract.
So to break that down a little bit, when you say fecal oral, you're basically talking about poop.
Exactly.
So somebody's come in contact with this material and they've moved it around and other people have touched it and somehow gotten it inside of their body.
Right.
The bacteria, the germs, the residue,
virus.
Whatever, the virus.
Exactly, and it can be microscopic. You
Okay.
can't see it for the most part, so it just takes a very small amount.
Okay, so as far as hepatitis A in Polk County is concerned, what are we looking at in terms of risk and, I guess, prevalence?
Okay, hepatitis A has been a problem in multiple states across the country for the past couple of years. We recognized a problem in Florida about 1.5 years ago. So we've been tracking cases in Florida since around January of 2018. Currently, the hepatitis A cases across Florida amount to around 1,800, when typically the state of Florida has about 120 cases per year. That's during the quiet time, the 5 years before this outbreak. So of the 1,800 or so cases in Florida, we've had, I think, a total of, about 30 cases since January of last year. So we haven't had a lot, but we don't want it to expand and have more cases. So we've been doing a lot of activity locally to help prevent this from becoming a worse problem.
And that's where you come in.
Yes.
So I'm told that there's a hepatitis A outreach team.
Yes.
So tell me a little bit about how that works and what you all are doing to reduce these cases.
Well, it's myself and my colleague Sylvia, and what we do is we go in the community and we target those high-risk individuals that we see an increase in hepatitis A. And one of the places that we've went is the jails. We've seen a slight increase there, and so we go there, we provide the vaccine to both the staff and the inmates as well. And then we've also seen an increase in the homeless population. So we visited our homeless shelters, and also we've teamed up with a liaison, a homeless liaison in both the cities of Winter Haven and here in Lakeland, well, in the Lakeland area also. So we go with him and we drive around to some of the concentrated areas where we see a lot of the homeless, and we open up our van as a mobile vaccination clinic right there, and we get a very good response. They come and we vaccinate. It takes about 2 minutes, and we take care of them right there, and we vaccinate them right on the spot.
So what is it about these populations that makes them more susceptible to hepatitis A?
Well, for instance, if it's homeless, they may have a compromise where they can't exercise good hand washing. And if they're coming in contact with hepatitis A, and then they're, as you know, it's the fecal oral route, they're touching their face, they're contracting it. So we're seeing increased numbers in the homeless population. That's just for an example. And then also with IV drug users or general drug users also as well.
So it's, and when people think about that, it's not like, someone's playing in fecal matter. It's someone has come in contact with it, however brief, and has touched a chair, and then someone else has come and touched that same chair.
Yes.
And so it moves that way.
Yes, it's highly contagious.
What would you say, and you said that these populations are very receptive to these vaccinations.
Yes, in general, when we go out with the officer, he has such a good rapport. I'm just going to use that as an example because that's one of our great successes. He has such a good rapport with this homeless society. So when they see him, they just come, and of course, he's gotten a vaccine. So that's like a great selling point. So he lets them know what we're there for, what our purpose is, and then they're very receptive. We have like 5 or 10 that come up. Majority, I would say about 80% of the ones that we come in contact when we're in the community, they usually get it, the vaccine.
So how do you determine who might need it? I mean, obviously living in these particular environments makes them at higher risk, but I assume in some part of life they may or may not have been vaccinated before. How do you determine who has and hasn't?
Well, we use the Florida shot system, and we can verify right then and there whether or not, we look at their history, and we'll find out whether they've had it or not, and then if they haven't, then we offer it to them.
Is there a time period in which the vaccination becomes less effective, like over a certain number of years or something to that
Well,
effect?
generally, you receive the first vaccine, and it's usually good for 11 years, and it usually protects for about 95%. And then in 6 months later, normally, you get the second, and normally it's protected for life, correct?
Correct, right.
So once you get that, you have like a 99% for life.
So it's a 2-shot series?
Two-dose
Two
series.
shots, yes.
Okay, excuse me, 2-dose.
2-dose.
Don't know the lingo, Dr. Johnson.
If I could add, if I
Sure,
may,
please.
in what we call blue sky days, when we're not in an outbreak, there are people that are recommended to get the hepatitis A vaccine routinely. And those are children at the age of 1, international travelers going to countries where hepatitis A is common, people who are adopting children or caretakers of people coming in from countries where hepatitis A is common, substance users, IV illicit drug users or oral drug users, men who have sex with men, and people who just want to be immunized. And it's really a very safe and effective. During this time of an outbreak, a lot of our efforts are really geared toward those at-risk populations that Kayla mentioned, of substance users and the homeless and folks that are in jail.
Right, and so just to reiterate, this is, as you say, among the safest of vaccinations. And what Kayla does is more of the high-risk population, but you would really recommend that for children age 1 and then those who may not have been vaccinated in their lifetime to really get that, because it's just an extra safeguard.
Right. We have almost 25 years of experience with this vaccine, and since this vaccine came out in the mid-90s, almost 25 years, there has been overall been a 95% reduction of hepatitis A cases in America. So it's a highly effective and very safe vaccine, and we encourage the public to talk about this vaccine with their healthcare provider to see whether they should get it.
And we briefly touched on the non-blue sky seasons, the outbreak period. Is that currently what we're experiencing here in Florida or in the United States or the world?
There are about 20 states in the U.S. that have had outbreaks, and obviously Florida is one of them. So it really depends upon your state and region as to whether you're high risk at the moment. But the state of Florida is viewed as high risk, and all county health departments are involved in promoting vaccination to the most at-risk populations and really communicating. So the things we're doing are vaccinating those at risk and talking about hepatitis A, because the general public may not be aware of what it looks like, what does it feel like. And people with hepatitis A can be sick for a few weeks up to 6 months. About 80% of people in Florida that have contracted acute hepatitis A have been hospitalized. So it generally is for the most part, is not fatal. About 1 to 2% will die from hepatitis A, usually an older population with chronic diseases or underlying hepatitis B or C, but people don't want to be sick for weeks at a time.
No.
And it is preventable by vaccine and by hand washing.
So what types of symptoms do those individuals who have the disease, I mean, once you have the disease, what happens at that point? Is there a way to treat that and contain it?
Once a person contracts hepatitis A, the treatment is called supportive, which means, you IV fluids if needed, antiemetics. But the symptoms of acute hepatitis A are a progression of fever, nausea, vomiting, diarrhea, abdominal pain, and then leading to jaundice or yellow eyes. Okay, and again, individuals can be sick for a couple of weeks to a couple of months, and really up to 6 months. So people feel really in fatigue. Probably the number one early symptom is just a profound sense of fatigue and fever, and then the symptoms progress.
That doesn't sound very fun at all. That's why, of course, the prevention is the best case scenario before you even get into those symptoms. Keep you from getting them.
Absolutely.
Yes.
So you mentioned obviously vaccination and hand washing is the best way to combat this virus.
Exactly. People need to wash hands after using the restroom, before preparing food, and just good hand hygiene, soap and water, nothing fancy, soap and water, and just taking care.
And then you'll do your work out in those high-risk populations.
Yes.
I really didn't know quite a lot about hepatitis A, and I feel like I'm better equipped. And I got to tell you, some of those times when you're like in a big hurry and you just go with a little, hand sanitizer, now I've got maybe I'm just going to do a wash and a little hand sanitizer too. So. Make sure that that's not the case.
And I will add that sanitizer is better than nothing, but soap and water for hepatitis A is better than sanitizer.
Okay.
Okay. Data or studies show that soap and water is more effective than sanitizer. If you're out somewhere and that's all you've got, by all means use it, but when you can get to soap and water, that's better.
And just real quick, we're running out of time, but when you say that, Polk County has cases, it's not as many as some people may think, right?
Correct.
So
you want to talk about where they are?
Would you like to share?
Sure. Basically, what we're seeing is a lot of the cases are clustered in maybe the northern Davenport area. We're seeing that, and then also in central Lakeland. And we see a few outliers, but generally they're all concentrated in the areas that we're actually getting out there and vaccinating.
Okay.
So generally.
And regionally, the most cases have occurred in the Pinellas, Hillsborough, and Orange County areas, so we're right on that I-4 corridor.
Yes.
So we have not been as heavily impacted, but we work as a region with our messaging and our coordination of efforts so that all of us can reduce the risk.
Okay. And so are vaccinations offered to just anyone through the Department of Health if they would like to have them?
Go ahead.
Okay, well, generally we like to see them go into their providers, their family providers, but they can go into any of our health departments and receive the vaccine also. At our Lakeland location, there's Haines City location, and then the Bartow location as well.
Is there a cost for those vaccinations?
Well, generally, if they are in a high-risk group, then we can offer them that, make the determination and offer it to them at no cost. But generally come in and we'll make that determination based on whether they have insurance or what their needs are individually.
Ability to pay. Okay.
Yes.
Okay. That's wonderful. So it's available. Seek it out. Safeguard yourself and your children. And I get it. It's good.
Great.
Great message. Great work you're doing.
Yes.
Thank you both so much for coming in. We're out of time, so we got to move on, but thank you for being here.
Thank you very much. Appreciate it.
Florida is currently experiencing an outbreak of hepatitis A across the state. It's important for the Florida Department of Health in Polk County to bring awareness to the significant public health issue to protect residents of our community. Since January 2019, there have been over 1,100 cases of hepatitis A statewide. This is a drastic increase from the 122 cases reported across the state in 2016. The number of cases of hepatitis A have continued to increase since 2016, nearly doubling every year over the past 3 years. For more information on hepatitis A, give the Florida Department of Health in Polk County a call at 863-519-7910 or look them up on the web at www.polk.floridahealth.gov.